Gentlemen, let's be real for a moment. As we get older, conversations about intimacy can feel a bit awkward, especially when it comes to topics like oral sex. But here's the truth. According to the CDC, sexual activity remains important for many men well into their 70s and 80s, and misunderstandings about it can hold us back from enjoying fulfilling relationships. If you're a man over 65 in the US, dealing with changes like lower testosterone or erectile challenges, which affect up to 50–90% of us per Mayo Clinic studies, you're not alone. And talking about oral sex, it's normal, healthy, and can be a game changer for your well-being. Hi, I'm Dr. Larrisa, a board-certified urologist with over 11 years of experience specializing in men's sexual health. I've helped countless mature gentlemen from coast to coast, from busy executives in New York to retirees in Florida, regain their confidence and spark in the bedroom. Today we're diving into what is oral sex and the surprising things men over 65 often get wrong. I'll explain it clearly, bust some myths with science-backed facts, and share practical tips to make it safe and enjoyable. No shame, no judgment, just honest advice to help you live fully at any age. By the end of this video, you'll feel empowered with knowledge that could enhance your intimacy without relying on pills or pressure. And hey, drop a comment right now. Tell me where you're watching from and your age, like Chicago 68. Let's build a community of strong, informed men. Hit that like button if you're ready to learn. All right, let's start with the basics. What exactly is oral sex? In simple terms, it's using your mouth, lips, or tongue to stimulate your partner's genitals or other erogenous zones. It can be giving, you pleasuring your partner, or receiving, them pleasuring you. And it's a form of intimacy that's been around forever, not just for the young crowd. Biologically, it triggers the release of feel-good hormones like oxytocin and dopamine, which can reduce stress and boost mood, according to Harvard Health studies. For men over 65, it can be especially valuable because it doesn't always require an erection, making it a low-pressure way to connect. But here's where things get interesting. Many mature men I've treated hold on to misconceptions that stem from outdated info, cultural taboos, or lack of open discussion. Today, I'll debunk 7 common ones. Think of this as your myth-busting guide. Each one comes with science, emotional insights, and practical steps. Let's jump in. Myth number 1. Oral sex is only for younger people. It's too risky or unnecessary at our age. Gentlemen, this couldn't be further from the truth. A study from the National Institute on Aging shows that over 40% of adults, 65–80, report staying sexually active, including oral activities. Biologically, as testosterone dips by about 1% per year after 30 per Mayo Clinic, oral sex can provide stimulation without the need for full arousal, helping maintain prostate health through regular ejaculation, which reduces prostate cancer risk by up to 20%, according to a Harvard study. Emotionally, it fosters closeness, combating loneliness that's common in older age. Practically, start slow. Communicate with your partner about what feels good, and use pillows for comfort if mobility is an issue. One patient, a 72-year-old from Texas, told me, "I thought it was over for me, but rediscovering this brought us closer than ever." Myth number 2. Oral sex always leads to infections or STIs. It's unsafe for seniors. While it's true that STIs like herpes or HPV can transmit orally, the risk is lower than you think if you're mindful. CDC data shows STI rates have doubled in adults over 65 in the last decade, but that's often due to not using protection, not the act itself. Biologically, good oral hygiene, brushing, flossing, and mutual testing reduce risks dramatically. Emotionally, knowing the facts eases anxiety, letting you focus on pleasure. Practically, get regular checkups, use dental dams if needed, thin barriers for safety, and discuss history with partners. Remember, it's safer than many assume. A 67-year-old client in California shared how open talks with his doctor made him confident again. Myth number 3. Men can't enjoy receiving oral sex if they have ED, It's pointless. Absolutely not. Erectile dysfunction affects 52% of men over 40, per Johns Hopkins. But oral stimulation can feel amazing regardless, as it targets sensitive nerves directly. Biologically, it increases blood flow and can even help with mild ED over time. Emotionally, it shifts focus from performance to mutual enjoyment, reducing shame. Practically, guide your partner gently, a little slower here, and experiment with positions like lying down. I've seen patients in their 70s report renewed excitement after letting go of this myth. Myth number 4. Oral sex is one-sided. It's all about pleasing the woman. This is a big one from older generations. In reality, it's reciprocal and can be incredibly pleasurable for men too. Studies from Kinsey Institute highlight that mutual oral sex enhances relationship satisfaction by 30% in long-term couples. Biologically for men, it stimulates the frenulum and prostate indirectly, leading to stronger orgasms. Emotionally, it builds equality and trust. Practically, take turns, start with light kisses, and use lube if dryness is an issue common with age. A 69-year-old from Ohio said, "I always thought it was selfish to receive. Now it's our favorite way to connect." Myth number 5. It's dirty or unhygienic. Real men don't do that. This stems from stigma, but hygiene makes it clean and enjoyable. Mayo Clinic advises simple showers beforehand reduce any concerns. Biologically, the mouth and genitals have natural bacteria, but risks are minimal with care. Emotionally, embracing it can liberate you from outdated shame. Practically, use flavored lubes or mints for fun, and trim hair if it helps. Patients tell me this shift mindset changes everything. Myth number 6. Oral sex replaces real sex. It's a downgrade. Not at all, it's an enhancement. For many over 65, it complements intercourse, especially with health changes. AARP surveys show 70% of seniors value variety. Biologically, it diversifies stimulation, keeping things exciting. Emotionally, it deepens bonds. Practically, incorporate it as foreplay. Myth number 7. You can't talk about it, it's embarrassing at our age. Wrong. Open communication is key. Emotionally, it reduces misunderstandings and builds intimacy. In summary, oral sex is a natural, beneficial part of intimacy that many men over 65 misunderstand. But with the right knowledge, it can enrich your life safely. It boosts health, emotions, and connections without pressure. Here's your 4-week action plan. Week 1, educate yourself. Read one reliable source like Mayo Clinic on oral health. Week 2, talk openly. Have a light chat with your partner about interests. Week 3, try basics. Experiment gently, focusing on comfort. Week 4, reflect and adjust. Note what works and see your doctor for any concerns. Important disclaimer: this isn't medical advice. Consult your physician, especially if you have conditions like diabetes or heart issues. Safety first. Gentlemen, age is just a number. With the right info, you can enjoy passion at 65, 75, or beyond. If this helped, hit subscribe for more weekly tips on men's sexual health. Comment below, which myth surprised you most? Share this with a buddy who needs it. Stay strong, stay connected, you've got this. You've